All right, well, thank you, Bob. I do want to give Bob a little bit more of an introduction. So Dr. Shin was at the University of Maryland and has studied MS for a long time, and then we were able to recruit him here from the University of Maryland. He's a neuro-ophthalmologist with Dr. Osborne, who will be talking later also. But Dr. Shin has a very long and storied history that is replete with many accolades, teaching accolades, and so we were thrilled that he was able to come to Georgetown. So what I'm going to talk about today is the MS Patient-Centered Specialty Home, a new approach to caring for MS patients. So this is, for me, a very, very exciting project. What do we mean by an MS patient-centered home, and what do we mean by a new approach to caring for patients? So if we look at this first slide, this is what healthcare looks like. It's a mess, the one on the left. The patient is in purple, and they need to navigate the system where they need to get consultations, they need to see their primary care doc. The primary care doc says, well, why don't you go see another consultant, go get this lab work done, here's some medications, what are the side effects? Don't worry, they're all fine, you don't have to worry about that. And then somebody walks home with a bunch of medications, they see a specialist. Did you communicate back to my primary? Sure, I'll send them a letter, don't worry about it. And then you go see your primary care doc. So I've seen 3 people, oh, I haven't heard from anybody, but you're probably doing fine. Just keep taking all the medications. And it's chaotic. What we want is on the right. We believe that there is a movement called patient-centered care, where the patient is at the center of care and not at the periphery. And the idea is that the team then reaches out to the patient proactively and says, what is it that you need? Or how can we help you? What are those things that you need? And that primary care physician is no longer primary care. The person who's organizing it is us. If somebody has multiple sclerosis, really, for the most part, most of their problems are neurologic, and they're otherwise pretty healthy. So you go to your primary care and say, well, you just say, what do you have? I have MS. And they're like, oh my God, I don't know anything about that. And they don't really do a whole heck of a lot. They may do some maintenance stuff, but that's not where your care should be. At least that's our feeling. We feel that patients should be part of a larger patient-centered specialty home that has an internist as part of it. Or your internist can collaborate with us. But what we want to do is try to coordinate the care in a much more meaningful manner that is patient-centered. And this concept that the patient is at the center of healthcare, not the hospital, not the physicians, but it's actually the patients that are the ones who should be benefiting from what's going on. So this is the model that we are moving towards. So this is the definition. The patient-centered medical home is a model for care provided by physician practices aimed at strengthening the physician-patient relationship and replacing episodic care, that is an office visit, based on illness and patient complaints, but changing that away and going to coordinated care and long-term healing relationships. So this is from the National Center for Quality Assurance, NCQA. And this, there is absolutely no question. If you look, this is a recent Journal of General Internal Medicine provides a core definition, but it's a team of people that are committed to improving the health of individuals in a community. We look at the MS population as our community. We feel very passionate about this. We also feel that there are many MS patients who are not part of this community and probably are not getting adequate care. We know this. And we firmly believe that we can develop a process, a home, if you will, where any patient with MS could come and have whatever their needs are met, whether those are equipment needs, behavioral health needs, whether they're internal medicine needs, whatever those are, those needs could be met in that area, one-stop shopping, as it were. And we want to go out into the community. It doesn't have to be, oh, you have to come to the hospital or to a satellite clinic to see this. The concept of potentially a home visit for those patients who are unable to leave their house or homebound is going to be part of this project. So you can see this is a very, a very far-reaching and aggressive approach to caring for patients. You can see the joint principles here. Clearly, the patients are at the center of all of this. It's a team-based approach with the physicians, our nurse practitioners who are also practitioners, medical assistants, our office staff, nutritionists, pharmacists, behavioral health, case managers, social workers. We are going to durable medicine, durable equipment. But you can appreciate that all of these pieces are going to work together rather than work disparately. And we feel this acutely on a day-to-day basis. There is a commitment to care, and so there's a partnership. When we have you come in, one of the things that we will do is formulate a plan with you and say, we think this is a long-term plan. And we're kind of doing it now, but I'm not sure we're doing it in an absolutely cohesive manner. And so we are in the process of making this transformation, which I'm going to talk to you more about. What are our features of this? Essentially, every team member at the MS Center is going to be used to his or her highest capacity. And it's amazing. Most of you may remember Joyce Mills, who was my secretary probably about 10 years ago. Joyce had no medical training, yet she could triage questions on the phone. She could say, I think this patient needs steroids. She was amazing, and she really rose to a level well beyond her training. And we feel the same thing about our staff, that each of them, we really want to have them develop professionally so that they can reach out to all of you in a meaningful way. The other thing that we will be doing is cultural competency training for our team. We think that we are pretty good, that we're culturally sensitive to things. My parents immigrated here from Italy and couldn't speak English, so if I'm not culturally sensitive, nobody's going to be. But I think all of us have probably had the experience that, my doctor just doesn't quite get me. And so for all of us in the center, that training or being sensitive to that is going to be a big thing. Health literacy. How much do patients understand about their health? That's going to be a big part of what we're going to be reaching out to. How can we educate you better about what you want to be educated about? Huge. And then we're going to establish connections to not only to other physicians, but to the community and other available resources. We have the MS Society that we're reaching out to, but also the mental health societies, other groups that we can bring into the care of our patients. And then, and I'm a huge believer in this, self-management support. A lot of patients, when they hear that, oh my gosh, I have MS, they feel disempowered. They're like, what am I supposed to do now? Now I have to take medication. And they feel like my life has been taken away from me, things have changed dramatically. And what we want to do, and I think what we currently do, is we do encourage people to be empowered, and doing that in different ways. Watch your diet, exercising, taking supplements, sleeping correctly. But we want to do it in a more systematic way so that everybody comes out with a plan. And a big thing is we will be engaging in advocacy for our MS community with the MS Society as well as other to go to Congress, to local boards, and really fight for our patients and what their health care needs are going to be. The next 4 years, regardless of what your political persuasion are going to be difficult. And we have no idea what things are going to look like. But we can be certain that they're going to be more difficult. They're not going to be easier. That's just the way healthcare is going. And so we have to be prepared to take care of our world, as it were, our MS community. And that's our job. We want to be kind of that blunt edge going right into the fray. Now, the idea of patient-centered medical homes is not new to us. We are taking this idea from the primary care community who has done it and has done it to some degree, but we don't know how good they do it for patients who have chronic disorders. They're pretty good with simple things, but we don't know about chronic disorders. And there are a number of groups who actually will certify us to say if we're doing this correctly. So it's not that we're just going to go out there and say, oh, we're a patient-centered specialty home. We have to be certified. We have to demonstrate that we are doing a lot of things that are patient-centered, that we are taking care of patients in a different way. And in particular, you'll see at the bottom here, there's NCQA, the National Center for Quality Outcomes and Assurance. NCQA is very vigorous. It's basically like getting a Michelin star if you can get a star from them. There's only 3 stars that they'll give you. And if you can demonstrate that you have high caliber patient-centered approach and that you're caring for patients in a proactive way, you can get 3 stars. And this is a year-long process for us to try to get to that point. We are going for the 3-star approval process with NCQA, but it takes an enormous amount of work to organize and to get there, which I'll talk about. What do we think this is going to do in the long run? We are hoping that this will decrease emergency department visits, that we can take care of things proactively. We want to help patients control their disease and avoid needing emergency care. And so we hope that as patients are better cared for and as we as a team all engage everyone better, that people will have less emergencies that will pop up. There's always emergencies that are going to pop up. We can't avoid everything. But those that are avoidable, we would like to avoid. We really want to keep people out of the hospital. This is huge. We don't want anybody in the hospital. The hospital is the wrong place for anybody, first of all, but it's absolutely the worst place for anybody who has a disability or who's on an immunosuppressive drug where they might get an infection. But the bottom hash mark is our big one. We want to improve patient care overall, period. That's our goal, and we feel very, very strongly about this. The ACEP said, the realities of our current dysfunctional healthcare system stand in stark contrast to the laudable goals of patient-centered medical and specialty homes. And so this group basically said the patient-centered home is the right way to do it. The way we're doing it now is dysfunctional and is really not working, and we believe that. We want to be that purple row house. We want to be the different row house that's going to stand out, that people are going to say, that's funky, but what the heck, I'll give it a try. And we think that it will be of value. Now, to do this, we have to show its value. So research has to prove the value of the medical home before it's widely adopted. Our goal is to develop this model of care, and then roll it out to other MS centers throughout the country and say to them, we think this is the appropriate way to care for patients, and we think that outcomes will be better, patients will do better, there'll be less disability in the long run, less urinary tract infections, less mental health issues, all this. And people are going to say, well, you got to prove it to me, especially if you're in Missouri, the show me state. They're going to say, you got to show me. And so we have to, as we build this model, we're going to have to prove to people that we are actually improving outcomes. So this is where we need your participation. The MS Center over the next year will be transformed into a specialty home. It's going to take about a year. We have a consultant group called Discern Health who has come in and is coaching us on how to get there. It's a very expensive proposition, but it's worth it. And Discern Health is coaching us on how to become a center over the next 12 months. We also have engaged a web-based company called Tonic, and they are developing web-based and iPad-based surveys that we can do that are really a lot of fun to do. But what these surveys that we're going to ask you to do will tell us a lot about you in ways that we've never really engaged in before. And we're going to do this as part of a study. So everybody that comes to Georgetown, whether it's Chevy Chase, whether it's Montgomery General, whether it's here, the patient-centered specialty home, you'll all be part of it, period. You'll notice changes over the course of the next year. What we would like is to have about 500 of you. So we have almost 2,000 patients, a little bit more, that come to us. But we're looking for about 500 of you that would like to be part of the study to say, are we actually better over time? And this is a 3-year study, and we think it's a fantastic opportunity to participate in we think is a groundbreaking approach to taking care of MS patients. So what would this mean to you if you were part of the study? So we would ask you to fill out patient-reported outcome surveys on an iPad or on your computer at home. They would take really no more than just a few minutes. You would be told, there's actually an app that's going to be developed, or I think is already developed, that will tell you when, oh, there's a survey we'd like you to do. And these surveys are extremely important quality of life surveys. And what they're going to do is capture information about many different things. How is your mental health? How is your physical health? How is your employment health? All of it's anonymous. All of it's going to be de-identified, so we won't know who's telling what. But it's an incredible amount of data. You will put it in, and you will have your own patient portal. So you'll have your own almost Facebook page, if you will. You'll go into it, you can do your survey, and then all the results will be there. And then over time, you can kind of see how you're doing. And say, you know what, 2 years ago, I did this survey, and I just did it again. Let me just see where I am now, and you can plot it and graph it and do all these things. That site, that patient portal also will have patient education in it. It will have links to other things. It'll kind of be your place to go for MS information, but then it'll take you elsewhere. But that's your own portal, and we're going to try to make it so that you can adopt it any way that you want. But as part of that portal, that's where you would go, or you can use your phone to do it, or an iPad to fill out these surveys. It would be very brief, but they then inform us of your quality of health so that when you come in to see us, now, if I haven't seen you in 6 months, I now have 6 or 7 surveys that you filled out. And I can quickly look at those and say, oh, this is great, before you even come in the room, and start to say, aha, I can see some issues that have come up or not come up. And then longitudinally, we can then say, you know, over the past 2 years, I've noticed, we've been looking at these surveys, we've noticed this. And then we can do it as a group. We can take all of this data and then divide it up into male, female, age, whether somebody has relapsing remitting, primary progressive MS, and then internally, we can look at our whole population and say, so what's going on with our folks? Are we seeing any trends that are going on here? All de-identified, so we can't tell who's who, but will give us tremendous, tremendous insight. And again, the surveys are going to be pretty brief, and so it's not going to be really much of a time commitment. There is one exception. At the beginning, it takes about an hour to enroll into the study because we have you do a number of surveys simultaneously. We do an exam. There's other data that we collect. After that, all the remaining surveys are pretty brief, and you do them. They really shouldn't take more than a couple minutes, and you do them at home, or you can certainly do them in conjunction with somebody else, but pretty straightforward. So it's a little bit of a time commitment, but we think would be well worth the time, and I think you're really going to be part of something really revolutionary. Again, all the data we collect is going to validate whether this works or not. And we've already gotten some national attention from this, and you can see this is an article that was published in our Neurology magazine, and it's already, even though we're just starting, has already garnered a lot of attention from the community, who really is very interested in how this is going to work. So all of you are going to be really pioneering this effort for us. Those of you who are interested in doing this, there is, outside there is a sign-up table that also has an informed consent. You don't have to do anything with it. You can just take a look at it. That's just for your own information. But they'll take your name, your email address, and your phone number, and then we'll contact you and say, look, if you want to be part of the study, great. Come on in, or we'll do it at your next visit. So if you say, well, I'm going to be coming in March, perfect. When you come in March, your visit will be a little bit longer, and then we'll have you enroll in the study and then give you all the information on how to use the the iPad and the web-based programs, and then you're off to the races. I think you're going to find it really very educational. Now, I have to thank the people who are doing most of the work. And so at the MS Center, and go ahead and please stand up. So Susan Stewart, who is one of our nurse practitioners, who you guys will, is going to be talking a little bit later. So Susan is really spearheading a lot of this work with Alexis Carlson. So Alexi is our director of clinical trials, and she oversees clinical trials not only for MS. We have about 20 clinical trials, but also for movement disorders and Alzheimer's disease. And then Nasima, who most of you know, Nasima is a physician, but who just got her master's in public health. She just got it, I think, last month, and so she's done a lot of work in epidemiology and global health, and so this is the kind of project that she's really very passionate about. I also want to thank Biogen, Terry Livingston. I don't know if Terry's here. Not here. So Terry has really helped move this project along. This is being funded by an unrestricted grant from Biogen, so we appreciate that. Also have to thank Tonic, who is a software group that is making the iPad and the web-based program, which are really a lot of fun to do. These are not just, oh, here's a question, here's an answer. They're really very interactive, colorful. It's almost like Pokemon Go type of thing. It's pretty cool. And then Discern Health is our consultant group that has come in. Pat Farmer, who I don't know if is here either, but this is a group that has transformed practices in primary care, but has not done it for a specialty group. We are the first in the country, or the first in the world, to actually develop this for MS. But we need their coaching. And like I said, it will be a year-long transformation. So by next December, we will have been fully transformed. Our study will go on for 3 years. And during that time, there will be a period of time between now and June or July where we really haven't transformed. And so a lot of the things that you are going to tell us are during a period where we're not really doing everything yet. But later on, things will change, and then we'll see if the surveys change. The other thing that we will ask is some of you, we will have a patient council where we'll ask some of you to come in and give us advice and say, how are we doing? How do you think we should be doing things differently? That's a bit more of a time commitment, and I'm not asking anybody to volunteer for that now, but if anybody does think they would like to be on a patient council, it's a bit more of a time commitment, I will tell you that, but we would love to have people who are really very progressive and forward-thinking. And Dr. Shin has already shown this picture, and I'm going to stop here, but some of you may remember when John Rickert, who was here back in the early 80s, and it was him alone, and really John was the one who first started taking care of MS patients here. But our group has grown, and as Dr. Shin said, there's 3 people who are not even shown here. So it's a very robust group. We will continue to expand, and hopefully all of you will embrace the concept of patient-centeredness and will realize what it is. Whether you're in the study or not, all of you will experience it at some level. And so I'm going to stop there and pass off.